If you've got children and you're concerned about the recent news about a rise in cases of hepatitis in children, this video will explain what to look for and what might be causing this. In the past few weeks, an alert has been put out for all doctors to look out for signs of hepatitis in children, as there have been a bunch of new cases identified, which are not linked to the typical causes that we would usually expect. The most important thing to note here is that these cases are still very rare, so there's no reason for parents to start to panic about this. And the intention of this video is not to raise concerns further, but hopefully to give you some reassurance and confidence in knowing what to look for if your child is unwell. These are the topics I'm going to cover in this video, and you can skip ahead using the links below if you'd like. Hepatitis means inflammation of the liver. It's a general term and has several different causes. Hepatitis is most often caused by an infection with a virus. The most common types of viruses that cause this are hepatitis A, B, C, D, and E. Each of these viruses affect the liver in different ways. Some of these are less serious than others. For example, hepatitis A and E are usually short-term illnesses that are usually caused by eating food that's been contaminated with the viruses, whereas hepatitis B, C, and D are spread through the blood or body fluids, and these can sometimes lead to long-term or chronic liver disease or damage. However, the current spate of hepatitis affecting children does not appear to be caused by any of these typical hepatitis viruses. We do know that other viral infections such as the Epstein-Barr virus, which also causes glandular fever, and also the adenovirus can cause hepatitis, though these are less commonly associated with it. There are also non-infectious causes of hepatitis, but these are unlikely in the children affected. Examples of this would include alcohol, certain medications, fatty liver disease, hemochromatosis, Wilson's disease, and autoimmune hepatitis. It appears that children up to the age of 13 have been affected by this so far, with the majority of these affecting children between the ages of 2 and 5. This was first noted in the UK, but cases have also been found in other countries, such as the US and in Spain. Now let's help you figure out what symptoms and signs to look out for. The tricky thing here is that some of these symptoms are very non-specific and can occur with many other infections that are not necessarily concerning. For example, your child may develop a headache, fever, lethargy, poor appetite, muscle or joint aches, abdominal pain, nausea or vomiting. But as you probably know, these are symptoms that are associated with some other very common infections that are not as serious as hepatitis. So these symptoms alone are not necessarily concerning. But normally we would expect these symptoms to go away after a couple of days and not persist. The more concerning symptoms which are indicative of hepatitis are jaundice, which is yellowing of the skin and the whites of the eyes, darker coloured urine, which may look as dark as cola, or pale coloured stools. Any of these signs needs urgent attention by a doctor. So, if your child has the first set of symptoms with an obvious reason such as a cold, and they don't have the more concerning symptoms, you should probably be cautious and keep a close eye on them. But if these symptoms persist for more than a couple of days, or your child appears more unwell than usual, or if there's any suspicion that they may have these more concerning symptoms, you should definitely see a doctor. If we suspect that your child may have hepatitis, they'll need an urgent blood test and examination. At present, we aren't sure of the exact cause of this type of hepatitis, so we're actually being advised to do several different types of tests, which may include a blood test, a throat swab, urine sample, and a stool sample. These will check for hepatitis A to E, along with a number of other infections, such as Epstein-Barr virus, cytomegalovirus, herpes simplex virus, adenovirus, leptospirosis, and several bacteria as well. The treatment depends on the severity of the symptoms. Sometimes the inflammation of the liver may settle on its own without needing any treatment, but sometimes medication may be needed to reduce the inflammation. In rare cases, and I must stress that this is not common at all, this has led to liver failure. But this is in a very small number of children, so again, this is not a reason to panic, but to remain cautious and monitor these signs and symptoms closely. These cases have been occurring in several different countries around the world, but no clear link has been identified between the cases yet. As I said earlier, the most likely explanation is that a specific virus is causing this. Once we can figure out which this is, further advice will be given on how to potentially stop its spread. Hopefully we will have an answer to this in the coming days and weeks, and I'll put an update to this video up here when that is available. Until then, stay safe, and feel free to share this video with others. If you'd like to know exactly what a fever is, you might want to watch this video. If you want to know more about coughs and COVID, check out this video. And I will catch you next time. See ya!